All right, Matt. I know we kind of like this do this before, and people love what we did. So, like, can you introduce yourself a little bit?
Yeah, for sure. So my name is Matt Tuttle. I've worked in professional sports now for the better part of 10 years between the NBA, MLS, and the NWSL. My specialty focus is really in sports science and rehab. So I have my DPT, board certified in sports and orthopedics, with a manual therapy fellowship, and then additionally, I'm working on my PhD in sports science with a focus on workload in the NBA. So previous roles as the director of sports science with the Denver Nuggets, and then most recently the head of medicine and performance with the New York Red Bulls. And right now I'm just doing some consulting around professional sports and trying to figure out what the next step is for me.
Cool, cool. So, um, like you mentioned, you're a DPT, and you also like try to learn, understand all about like load management. I think I remember that's your like PhD topic. Am I right?
Yes, so my PhD is a specific focus on external workload in the NBA. So looking at, for those not familiar, uh, kind of the external output that players are performing. So distance run, accelerations, decelerations, jumps, total distance, sprint volume, kind of all of these metrics that we track across the course of games. So we're going to look at the last 5 years of NBA data and see what patterns we can shake out. And we're going to look at that over three different phases. I always get hesitant to use kind of acute and chronic in the workload space because I know that that language certainly gets people going down that like acute to chronic workload, and we're not necessarily looking that way, but instead of, trying to put this into a ratio, just looking at, hey, across a 3 game week, a 4 game week, and a 5 game week, what is an average player playing this many minutes play? What do bigs do? What do smalls do? Is there variation every 20 or 30 games across the course of the season? And then is there variation season over season that we can see as kind of the game changes as well? So we're in the early stages of that, just trying to get the data organized. It's a lot of data to deal with, as you can imagine, with every player that's been on the floor for every team for the last 5 years, and may end up being 6 years by the time that we actually run the metrics.
Cool, cool. So, um, do you think that have a PT background help you understand more for the sports science, or like do you think that this two like area like kind of like had contract with with each other?
Yeah, I think it's super helpful because I think for me, the medical side, so often we paint medical and performance against each other, right? Like the medical guys are trying to hold them back, the performance guys are trying to push, the coaches are trying to push even harder. And I think when high performance is functioning at the highest level, that's not actually the case. I think everybody should be working uh, kind of in parallel and working in the same direction with each other, like getting everybody to row in the same way. I think for me, it's helpful because if I'm working like purely in a sports science role, I'm able to communicate with the medical staff and understand what their concerns are, and then at the same time being able to like feed them the information back that they need, or feed, say, the strength coaches or the skill coaches, whether it's like a player development coach or head or assistant coach, feed them the information they need for the game perspective. I think the other piece that is certainly beneficial is understanding, especially in the NBA, the recovery timelines of certain tissues, right? So understanding that like bone, tendon, and muscle are all going to respond across different timelines. Like their maximum pain following a stimulus is going to occur at different moments in time, and that certain stressors are going to stress certain tissue differently. So having some of that medical background on like the physiology behind that, I think is beneficial to try and blend the two and then understand kind of the S&C side of how to load it in the gym or progress that onto the floor. So this stuff all has to work work together and work in the same path, whether like some groups call that interdisciplinary or transdisciplinary, like whatever language the group is using.
Nice, nice. I like it. I like it. So, um, as an SNC coach, we always talk about load management, and load management right now is like reactive strength index, peak power, player load, peak velocity at catapult. I never really like hear a performance coach or a strength coach talk about uh uh the timing of like tissue like recovery, like you mentioned, like bone, soft tissue. So can you explain like the timeline for different tissue to recovery?
Yeah. So I think for me, I was actually just talking, and I'll shout him out. Rich Willie out of the University of Montana has done a bunch of stuff on bone stress injuries and endurance athletes. So he and I were just having a conversation the other day on this. They're like certain tissue, whether we like if we, it gets certainly deeper and deeper, but to keep it fairly general, like if we just had bone, tendon, and muscle, if we look at the maximum pain response time after a stimulus, it can kind of be indicative of what we're dealing with. So like bone generally responds faster, and there's kind of two peaks for that. It's usually like that evening or first thing the next morning, and you're looking at your maximal pain response to a stimulus, where muscle is going to be that like, DOMS, delayed onset muscle soreness that everybody's familiar with in that 24 to 48 hour window, and then tendon being a little bit more delayed from that as well in the peak response time. So I think understanding that, particularly in the event of like managing load, as we would call it, of like, hey, if we're trying to return a player to the floor, they're coming off of a tendon injury. When are we concerned with their tendon soreness? It's like, well, if it's at, and it's obviously a group decision, right? Like it's very contextual, but like at this level, measuring it between kind of 48, 72 and 96 hours. Excuse me. So I think that as opposed to say somebody coming off like a fifth met fracture, and they've just had a screw put in their foot. And if they have bony, if they have soreness that night and the next morning, it's certainly concerning. We may have overloaded them. And then the tricky part on this is, well, what is an underload, right? Like it's very easy to point to an overload and be like, well, it's over this threshold of pain for our comfort level at this moment in time. But then the underload is like, well, do we want some soreness? Do we want no soreness? Are we being as aggressive as we can if we don't have certain moments of exacerbations? I think that's where it really gets probably the trickiest. And then to circle back on your initial like workload management, I think that's always the one for me that is challenging. I think the NBA certainly you get a little bit of like regulation on itself as teams play 3.5 games a week, and it's 3.2 to 3.4. It's very much like an every other day schedule, so players are allotted some recovery time anyway. But I think we need to spin the view from managing load to maximizing player output. Like our job is not to manage these players and pull them off of the floor and use data as an excuse. It's to maximize their performance capabilities on the floor. Um, and I think the hope with the PhD work is that we end up having this data on a bigger scale. Teams and staffs trying to do this on really small scales with like, oh, their RSI is down today for their jump metrics. And it's like how accurate is the data that you're looking at? Um, I don't think that I'm not going to sit here and lie and be like, I'm like a statistician. I understand the stats backing this information at the highest level. But, I think we're working on really small data sets with a high degree of variability, which makes it really challenging to make decisions off of when we're not even sure. And if you look at some of the data, like some of these devices aren't nearly as accurate as we think they are. So, a 10% margin of error, and now you're talking about making a change on, oh, well, they're 5% off of normal. Like, oh boy, that's you're kind of in a tough spot. So sorry, I threw a lot at you on a
No,
single
no,
question.
no, no. I love it. I love it. And I kind of like understand like I feel the same way you feel like, especially like I got access to like different force plate. There's like a lot of kind of force plate, and like because like I don't know why, but we get access to like different force plate at Louisville. So and there's one time I'm gonna use like I need to use drop jump to test their
Mhm.
RSI. And when it comes to like force plate, there's like RSI, peak power, whatever it is. But like, and then like when I check their body weight, the body weight isn't right. So if the body weight isn't
Mhm.
right, is the momentum right? So is the if the momentum is the force right? I'm like,
Right.
and the body weight is like way off, like 5 kg way
Yeah.
off. It's like 10 pounds off. I'm like, so is the data
Yes.
we're tracking right? I'm like,
And that's where I think I always forget who wrote this, and it kills me whenever I bring it up. There's a paper a while back. Jesse Green shared it with me. He's with the Pittsburgh Penguins now, on invisible monitoring. And it was like, the whole concept of like being able to track stuff that players are doing without, like, they're knowledgeable and they're looped in, like they know the data is being tracked, but we're not adding stuff to them, right? So it's not a force plate, it's not a groin squeeze, it's not a Nord board for an isometric hamstring, right? Like we're not adding stuff, but instead just like they're going through their day and you're tracking stuff along the way to have it. And that's to me where I think the external workload stuff can be so interesting, paired with stuff that's happening in the gym already. Because guys are getting that stuff tracked in game already, right? So like the NBA currently uses Second Spectrum as their optical tracking system, so players' data is obtained every game, no matter what. Where if I'm jumping on force plates in Denver and then we travel to Louisville and we set them up in Louisville and then we got to have them jump there and it's at a different time of day and sleep it, like there's all these contextual factors that go with it. I feel a little bit more challenged with some of these devices. And even then, like, there's certainly an argument to be made about the external workload data too on this, like, second spectrum connects on catapult. How accurate are those devices? And the NBA does a nice job of vetting and providing that information to teams of the accuracy, so you know what you're looking at. But oh yeah, it's a big black hole as far as what you're looking at, and
yeah,
is it actually helpful for the player?
yeah. Sorry. But like for in your experience like handling these like data or like because you're the director at Denver Nuggets, right? So uh, how do you handle these data? Like yeah, like since we
Yeah.
know sometimes it's not correct.
Yeah, I think it's being really honest with everybody, front office, coaches, players, S&C staff, medical staff, on like what we're actually dealing with. And I think it's making sure that you have a fairly large, I hate the term big data in sports because our data certainly is not big. But having a very honest conversation about like, hey, here's what we think we're dealing with, and here's what the player is saying, and here's what maybe an internal workload is. So trying to take the data and pair it with other markers that you're tracking. So it's not always just like external workload data or jump data or, groin squeeze. It's, hey, this athlete's had some groin soreness on the table the last 2 or 3 days. We also know that we're on, you know, our third game in 4 nights. We know the injury risk is up there. They're reporting fatigue. We found out X, Y, and they revealed X, Y, and Z is going on at home. So now you're pairing their subjective information of groin soreness, personal stress. We know the workload's high because of game density and travel. And we did a groin squeeze on them and their numbers are down 10 or 15%. That also correlates with, their acceleration and decelerations from last game were not in their normal range, right? They were like 2 standard deviations off of the norm. I think if you like put the whole story together, so you have a subjective and an objective component to it, That's probably the best way to use the data. I think pointing at any metric in isolation gets you in a whole shitload of trouble.
Yeah. So, um, in terms of like load management, like I know a lot of like teams utilize like post-game lift or pre-game lift or like game day lift. Like it's a thing like from basketball, track, like in a lot of sport you utilize this concept. So if we go like if we talk about like the tissue load or like timing for a tissue like bone, um, muscles, soft tissue recovery, like um do you think like post game this is always a question of mine, like post game lift is gonna like increase the load on the tissue that like they need more time to recover?
Yeah, it's a great question. And I think it gets to like the question, are you microdosing, are you macrodosing your lifts? And like the question that I always have around kind of S&C programs is how are we tracking volume and intensity in the gym? Because I think that we can track, it's not, it's rough, right? It's like SRPE, right? Like, are we going to use tonnage? Are we going to use just like total time in the gym, number of lifts? But like having something, and there's plenty of software platforms out there that can do this stuff for you, or at least give you an idea. For me, relative to the NBA, what you see mostly is like it's very microdosed after games. Like there's very few teams that are putting guys under. I'd say, as far as I know, no teams that are putting guys under extremely heavy loads after playing 40 minutes a night. The common way in the league that it's framed is like starters, rotation players, and developmental players, and then scheming workouts for each one of those groups based on minutes played and based on expected minutes played. And this for me always gets back to communication with the coaching staff and this stat, like the whole performance staff, medicine, S&C, sports science, having an awareness of the game and of what the coach's tendencies are too, right? Like if we have a rotation guy who, plays 17 minutes a game, but the starter at their position just sprained an ankle and we don't think they're going to go next game, it's like, is this the time to give them a really big hit after the game? Probably not. Like we know their minutes are going to go up in the future. Let's not add any additional physical stress. That said, if we've got a rotation player that normally plays 17 minutes a game and they're falling out of the rotation, there may be a chance here for a window of development after communicating with the coaches of what the next several games are going to look like. Can we get them a little bit bigger hit? So I think varying the dosage uh, with the training schedule and the playing schedule is what's most important. Like the game still has to be the focus. In these post-game lifts are more like, soccer does it as top offs on the field, right? Like there's additional running on the field to top off what you're going to. And like we don't look at it as a post-game lift, but like we're doing it for the same thing. We're doing it for hamstring and adductor health and to build up volume and intensity that they may have missed that game day. So using those post-game lifts as like a top off or just like to keep athletes building across the course of the season, or as some teams would frame it as like just blunting their losses because players are going to lose some strength across the course of the season.
Nice, nice. Since you brought up like soccer, and I know you worked with soccer before, right? So, in terms of like managing load, would you say like these two sport are more alike, or like it's like yeah,
It's very different. And so I think there's two components to why they're very different. I think the first is the schedules are really different. And certainly European soccer is changing, where like the number of games those teams are playing across the course here is incredible, but they also turn players over at a decent rate. Like they're not playing their same 11 every game at three on 3 game weeks. Like they just can't, your hamstrings and adductors can't recover in time. Some players are going to do it and be able to survive, but you're going to break a lot of guys along the way if you do it. But if we compared like MLS to NBA, most of these teams are playing 1 or 2 games a week, but you're not playing 5 and 7 or 3 and 4. So I think the structure of the season and the schedule changes the workload management on guys, or like what periodization plan is the other way. Workload management always challenging framing. And then because of that in soccer, you're able to build the weeks out better. And so you've got like, hey, we know we're playing on Saturday. This is what our normal tactical periodization is across the course of the week. We know this is going to be an intensive day. This is going to be an extensive day. This is going to be a short day. This is going to be a long day, right? Like you have your general week to week plan when you're playing one game a week. And then you're able to slot in your additional work, kind of your lifts and your top off sprints inside of that, knowing what the program is every week. So that certainly changes it. I think another component that changes it is the culture around the sport certainly has an impact. Trying to get NBA guys are not going to sprint at 90+% effort 2 times a week. You're just not going to get it. And in some ways, it doesn't make sense because the court's only 94 feet long. Like you just don't, those guys don't reach their maximum potential. And they're more acceleration, deceleration, vertical based athletes than soccer players that are going to be like top speed and total distance are the metrics that we're really interested in focusing on. So I see them as very different for the kind of those components. Like the demand of the game is different, and the schedule is very different. And then on actually like the tracking component or the AMS side and the integration with the coaches, also very different because the body of research in soccer, throwing Aussie rules football and rugby is so much deeper and broad than the research that we have in basketball. So we're in the process of a scoping review right now, looking at the research specific to the NBA. There's a systematic review that we've revised that'll hopefully be coming out soon on looking at intensity zones in basketball. And like the depth of the research is not anywhere close to what it is in soccer when you really dig into it. So I think that that also changes the kind of load management, sports science, periodization plans around it because coaches are more familiar with this space in soccer because it's been around for so much longer. So I think basketball will get there as we get more research published and a deeper understanding of what the game is and how it changes.
Cool, cool. So this make me want to ask a question like why exactly is like there's so much research on soccer,
Yeah.
rugby? Because I know like since I got here, I know like soccer, like when it comes to like tracking like the GPS, the actual GPS data, they're more in depth to that. It's like not just basketball. Basketball, we track the load with the speed, but like football, soccer, like their like positions are different. Each position had they track different stuff. And it's a lot of data. They know how to deal with that. Even the coaches know what it means.
Yes. And I think you've hit on it, right? So like GPS was used very early as the tracking system in soccer. In basketball, you're not using GPS, right? So we were limited to accelerometer data, right? So you've got triaxial accelerometers and LPS optical tracking systems were not the norm early on, right? So it was time motion, it was hand time motion analysis, which was really complex, challenging, time intensive. And so you're not going to back then also like staffs weren't the size that they are now. So like also the funding in basketball now allows you to do more. So I think like the technology piece was limited. The uh, uptake in soccer of data early on was certainly bigger, and teams have built out research departments to do with it. Or like, it's also been led by the organizing bodies. So there's the UEFA study on injuries in soccer, where teams are communicating information back to a central body on what injuries are. They've been tracking it for over 20 years. So now they can look at injury patterns across the course of years and then ask teams about their training patterns around that and look at how the game is developed around that. So they've got a lot of information from more teams in a more open sport to research, as opposed to the NBA, where certainly injuries are reported back to the NBA and the EMR, but that data is not then frequently published. There's certainly a few epidemiology studies around the NBA, the uptake of technology in the NBA was challenged until very recently, that players were fearful of that data being used against them, and you understand why when there's that much money on the line. So there's two really big factors there. So soccer's been doing it a lot longer. There was more technology and they've been more open to research, and that lends itself to having a bigger body years later. I think basketball is catching up, but it's catching up internationally first, and then the NBA is kind of trailing here, right? So we see a lot of research out of Australia, a lot of research out of Euro basketball, but we don't see a lot of NBA research. Soccer is a global game. You can research it at several levels all throughout the world. Basketball has been a predominantly American game until, God, I'd hate to put a number on it, but the last last 2 decades, it has become more international, and the league shows that.
Yeah.
Yeah, so I think we'll see it catch up in the NBA. The NBA certainly has their research committee that approves research for publication, which is a positive step in the right direction. The Players Association is involved in that, and so I think we're going the right way. I think it's really it's going to be a long time before it's caught up, and I don't know that it necessarily will ever catch up to soccer.
Yeah, man. Yeah. So you've been working with sports a long time. So, since you start and like now, like there's probably been a lot of changes in like pro sport. So like you start as a physical therapist and then like learn sports science. Um, do you have like out like let's say after you finish the PhD, what would be like the next like area you're interested in?
Yeah, I think for me, it's going to be to continue to push high performance research in basketball forwards. I have a really strong passion for the NBA, and I think for those that work in it, you have to. Like, there's certainly people that are interested in working in the NBA and then try it and they're like, wow, 82 is a lot of games. It's like, yeah, you gotta love the game to be involved in the NBA. And so I think for me, it's the PhD is an avenue to learn more information about the game, but is by no means like the end point. Like, I think there is several layers of NBA research that we can look at over the next 5, 10, 15, 20 years to help push the sport forward, uh, and then also help the players perform at their peak levels, for whether it's longer or at higher levels, whether, obviously like an intensity duration kind of thing. Like, how long can they be at their best? I think we've got a long way to go on that. We've got a lot of research in the pipeline right now on the medical side and on the sports science side, but yeah,
Yeah,
it's
man.
interesting. It's
Yeah.
a big opportunity for anybody that really likes basketball to start pushing in this space.
Yeah, yeah. So this kind of like made me think like a few months ago, like I think it's like a few months after I got to Louisville and our coach our coaching staff was discussing like what if what if the NBA changed their season to like college, like there's like 30 something games instead of like 82 games. They're saying like, man, that's gonna be the best basketball ever. That's gonna be the best back.
Yeah,
Yeah.
it's interesting. There's obviously the discussion publicly going on about shortening the season, and I'm not going to stick my fingers anywhere near that discussion. I do think from a fatigue standpoint, and like I can speak to the staff side, that 82 games is a lot, and fatigue certainly sets in across the course of the season. But on that same end, it's one of the reasons that, like, personally, I'm interested in researching the NBA because I think we are pushing human performance at a really high level to get guys to turn around every other day. Again, 3 and 4, 5 and 7, like, to push into these really challenging scenarios and still be able to perform. and mitigate risk to the best of our ability. So I see where college coaches are. I see where the public is like, well, if we shorten the season, this and that. That decision so far out of my hands, I'll react to whatever is
Yeah.
happens. But I do think it's interesting to try and keep players performing at that many games across the course of the season.
Yeah. So that lead me to another question. This probably is another awkward question. So back in the days, we got Kobe Bryant, we got Michael Jordan, we got Allen Iverson, those like legendary players, and they try to like perform day in, day out, day in, day out. And back in the days when they still play, like what exactly make them so good, like every day?
Yeah, yeah, I wasn't around. Like I've been in professional sports for almost 10 years now. So they were before, that generation is before my time. I grew up watching all those guys. But I think there's still, and it's why I kind of harp on the keeping the game the focus. I think in performance we have uh, we're so excited about our knowledge and about what we can bring to the table and how we can help coaches and players that sometimes we lose focus that like the game is central and the player performance is central. And staffs back then were two athletic trainers and two strength coaches for an NBA team. Like they weren't, you know, two ATs, two PTs, a sports scientist, three strength coaches, a data scientist. Like staff sizes have expanded tremendously. I I think there's like there's certainly a callus to playing sport. I like if you play a sport and build up that callus over a long period of time, like I hate to use the acute to chronic stuff here, but there is a little bit of face validity to the whole thing of like you just get used to playing the sport and your body adapts to the stressors you put on it. It's the whole physical stress theory. So if I was going to say something, I would say it's that, right? Like it's just like this physical accommodation to the demand that you're putting on the body and continuing to slowly progress the load that you're putting on the body over a long period of time. That said, that's a very subjective, anecdotal type answer. I'd certainly be curious trying to pull all of that data to see what has changed or what has not changed. I think any of that would be interesting, but that was before we had all of these in-game tracking markers as well.
Yes. It's like there's one time I was talking to like he's in he's in charge of our like mental health, and I was
Mhm.
asking like because he's a Michael Jordan fan. I was like, why is Michael Jordan so good, like compared to like the players now? It's like maybe it's mental toughness. I'm like, okay.
Mhm. And I think like grittiness at the time is real, right? Like, I mean, there's plenty of videos from those Bulls of like guys drinking beers in the locker room after the game. You're like, well, that's certainly not high performance. So, I think everybody's nostalgic too, right? Like, oh, well, it was tougher back in the day. It was better back in the day. I'm trying to look forward. I'm trying to get my little piece to help the league forward now, uh, and going into the future.
Yeah, man. So, with like go back to like load management with all those like data, with all those like tracking system. Um, we kind of touched on this on the last episode we did with the camera they have at the NBA. Um, do you like do you still think that like looking at like how the athlete performed like on the basketball field, just looking at how they perform, how they move would be like more accurate?
I'm super interested to see where the movement data is going. I think, God, when you think contextual factors, like that is uh, really an interesting space. So Trent Salo is a good buddy of mine. He's the director of performance for the Pistons. We were just recently talking movement science a little bit, and like I think it fundamentally boils down to how do you view movement. And he and I see it very similar that it is like in sport, it's a like kind of response to the external stimulus. Like it's not all in your control. The game is very chaotic. So I think because of that, it gets really hard to handle that amount of data. I think the next kind of arms race in the NBA is for shooting mechanics in shooting labs. I think you got to start there before you start looking at the chaos of the game to try and handle all of that data at an appropriate frame rate across multiple joints to look at injury risk or performance correlation is going to be really hard. But I think if you can get uh, biomechanics on shooting form and then motor learning theory and try and change jump shots in a controlled setting and then look to bring that to a chaotic setting, maybe you can affect the game that way from a performance standpoint. But boy, I think we're a long way away from that too. I think if you look at other sports that have been doing that for longer, being golf and baseball, and they've been looking at 3D biomechanics of pitching or of the golf swing for a lot longer. Like there's certainly patterns of what the best players do, but there's no perfect recipe to do it either. So I think that'll be the next like interesting arms race in biomechanics data going forward in the NBA.
Yeah, this is cool because we've been talking about like the shooting mechanics, the fatigue, how like how the joint moves like all season long. Man. That's gonna be interesting.
Yeah, I think it's going to be fascinating. I think it also, I think this is where a little bit of the sports science information crosses back to like the medical kind of physio AT, whatever we want to call it, side. And bringing in some of like I'm not like an FMS homer or an SFMA guy, right? But there is something to like understanding how a joint moves and whether there is restriction to that movement. So like people are going to shoot certain ways because they may not have, they may have had a lesion in their shoulder, they may have had a slap lesion in their shoulder that they had surgery on. So they don't have the elevation in their shoulder to get into the positions to make a jump shot be perfect. But so it's like working around those limitations to get them into. So yeah, it's going to be fascinating and extraordinarily complex. And I think you're going to need a lot of high level biomech and statisticians to handle some of this information.
Nice, nice. So, uh, the next part of the question is gonna be like, so you were the director at Denver Nuggets, work a high like elite level sport. So, uh, if let's say if a young coach want to work at the NBA level in the future, would you say like, because this is always this is also a conversation that I had with some of my colleagues that should we stick to like basketball all
Mm.
or like get more variety in like different sports.
Yeah,
What are your
that's a great
thoughts?
question. Um, I think it's for each individual asking what their kind of career goal is. I catch a decent amount of questions of like, well, I want to do what you do. How do I do that? And it's like, well, I don't think a lot of people know what I do, right? Like I sit behind a computer screen and I type up the same paragraph over and over again, trying to get it to sound good for a publisher. You get that email when you're in basketball, and it's like, do you want to unload a plane at 2:30 in the morning in the snow in Denver when you land? Like, so I think it's figuring out what your goal is, kind of in across multiple phases of life. Like, what's my 2-year goal? What's my 5-year? What's my 10-year goal? What's kind of a career goal? And I think that also needs to be in line with personal life goals too. Right? I think it's really easy in this industry to get caught up with I am going to chase my career. But there are only so many hours in a day, and basketball is a time intensive, travel heavy industry at the highest level. So what are you willing to give up? Because you're certainly going to sacrifice something on the other end to work in that space. So what I suggest to people is to figure out what those goals are career-wise and personally, and then understand the sport that you're getting into and the culture around that, right? Like, so I don't very do not speak on the NHL or on the NFL or MLB when I'm talking publicly because I don't know the lifestyle in those sports tremendously well, but I know they're different than the NBA. Like football, whether or not the schedule stretches to an extra game, right, is playing far less games, like under a quarter of the games of the NBA. So the travel that goes with that is different. But their off seasons also look very different than the NBA. And I don't know the space there. So for people looking to get into the industry, figure out the sport and see if the demands of that sport align with your career goals. Like, so personally for me, I'm really interested in pushing basketball performance forward and understanding the game and bringing research into that space. And I have an extraordinarily understanding wife who is willing to kind of let me chase this and know that for 41 plus games a year, I'm going to be on the road. And then I'm going to be in Vegas for 2 weeks in the summer. And then if there's a long-term rehab, that's going to take up whatever. So figure out your goals, career, personal, figure out the sport, and then decide what you want to focus on. And then I think the direction day to day gets easier. It's like, oh, well, all of my goals and values line up with wanting to work in the NFL. Now I'm going to reach out to people in the NFL. I'm going to look at continuing education that makes sense in that space and start chipping away to try and get into the industry that way, as opposed to banging on people's doors, telling them I want to do what you do.
Man, I love that. I love that. Because I also like encounter some people like, oh, they want to do what I do. But like I spend most of my day like watching research paper, watching like how the athlete move like thousands of times, literally thousands of times. Like
Yeah.
watching the same video thousands of times.
Yeah. And I don't think that it's always, I certainly understand the appeal that people see, right? It's like the lights, the camera, the show, it's on TV, it's a big deal, right? And all of those are certainly perks of being in the industry, but I think it's falling in love with the job that you're actually going to be doing because the novelty of having the logo on your shirt wears off very quickly. In very specific to the NBA, like players can see through the nonsense. Like they're very, very good at sniffing out who is a fraud, who is a fake, who is there for the wrong reasons. And you're not going to last long in an industry like the NBA if you're there for the wrong reasons. Whether because the players will lose interest in working with you or because like you'll just burn out yourself. You'll just run out of energy for it. When you're getting on a plane at 11:30 at night to fly from, you know, Denver to Louisville. Obviously, we don't make that flight, right? Denver to New York on the second night of a back to back, and then it's the start of a 2 week road trip. Like you're going to lose energy for that pretty quickly if you're not there for the right reasons. So find a
Oh,
sport you love and do that.
cool, cool. Last question. Like in your like career, have you ever encountered that feel like maybe sometimes you don't want to do this anymore? Maybe like this is too taxing for you, for your family, like takes all like your energy. How do you like process this and like what you mentioned, fall in love with the sport again or fall in love with the
Yeah,
job?
I think I think at every aspect of life, you like should always be evaluating, am I in the right space and am I going in the right direction? Again, career-wise and personally. Like I said, I have an unbelievable wife who understands that I'm going to spend a lot of time on the road, and that means that there will be times that she is certainly taking more time with our child or more time with our dogs to manage some of that stuff to allow me to do what I do. I think staying in that constant evaluation phase of is what I'm doing correct and does it align with my values? I love it. That said, am I doing it in 15, 20, 25 years? I have no idea. I know I would like to do it for a much longer time than I have so far, because I feel like we have so many questions to answer. But every year, asking and evaluating, is this a productive direction? And does this bring me happiness is tough, right? But like fulfillment is probably the right word. Like, is this filling the bucket for me to be away from my family?
Yeah, yeah. I love it. I love it. Thank you again for like doing this. So for those who are interested in what we're talking about today, where can they reach out to you?
Yeah, so my Instagram and Twitter handles are the same. It's Doc Tuttle DPT. One day that'll change to Doc Tuttle DPT PhD, I hope, but got another 12 to
Well,
18 months
well,
before we can do that.
well,
Uh,
well.
so those are the best places. I'm not super great on posting on either of those, but if you shoot me a couple of messages, if I miss the first one, just send a follow up. But hopefully we'll be pumping out some of the future research in those platforms here shortly.